Hi, this is Dr. Simanchal Goyal, and today we are going to see a very beautiful case of an IOL exchange. For all those residents and new fellows who want to perform their first IOL exchange, I am going to present you two golden tips for a successful IOL exchange. So, right at the bat, this lady came to me with the 1 week history of a cataract surgery, and to our surprise, the patient had a wrong IOL implanted in her eye because of faulty K1 K2 readings. This patient came to me from another hospital, so I took up this case. The surgeon has made job for me a little easier because the rexis is slightly on the bigger side, and it's best to perform IOL exchanges in these patients as early as possible. Preferable time is around 1 week to 2 weeks because the anterior capsular lip and the posterior capsule are not having a lot of adhesions in these cases. After a month's time, there is a lot of fibrosis and phimosis of the capsular bag, and it's best to operate an IOL exchange in after 1 week or under 14 days. So as you can see, I have inflated the bag with a lot of visco. I have just nudged a round cylindrical iris repositor and separated the capsular bag, and now I am just pushing one haptic of the IUL so that I can grab it with a tying forceps. Mind you, I am not using any fancy instruments whatsoever, and here you go. This is golden tip number one that I want to lay emphasis on. I'm going to just take one haptic out from the main port using a plain straight tying forceps. You don't need any fancy instruments. Now I'm going to inject some visco over the surface of the IUL, and golden tip number two would just be coming in a short while. So I would like your attention, please. See, this is a round iris depositor that I am using in my left hand, and I'll be using the straight tying forceps in my right hand. No fancy instruments, no extension of the main port. I am just going to take this IOL out from a standard 2.8 millimeters of main port incision. So I have just protected the corneal endothelium by keeping the iris depositor over the IOL surface. I'm holding it to protect the endothelium, and I'm going to do a twisting movement of the wrist joint. Mind you, your wrist joint should function in this move, and you're going to twist it and take this IOL out like this. So in some cases like these, you have to give it another nudge, and here you go. I'm going to slow this move down for you guys. So you stabilize the iris depositor in your left hand. You take a straight tying forceps and grab the optic haptic junction and start twisting it, and just like that, you are going to take the IOL out from a standard 2.8 millimeters incision. This is a life-changing move, so to say. This patient had an error of 4 diopters in biometry, and it was best to get her refractive error done. So these are the two golden tips that I would like to lay emphasis on in your early careers. Do not hesitate in doing IOL exchanges because later you're going to perform them. So golden tip number one, let me remind you, take one haptic out of the bag and take it out from the main port. Tip number two, take an iris repository in your left hand, take a straight tying forceps, nothing fancy, nothing out of the normal, just plain instruments that are there on your trolley, and just twist your wrist. That is what I would say it. And just take that IOL out of the bag and out of the main port, and here you go. This is the IOL that was actually required for this patient to have a good 6x6 vision. As you can see, there has not been any injury whatsoever on the corneal endothelium. This is one surgery that risks the injury to endothelium, but if you have a good hand-eye coordination, and a good iris repositor, a stable left hand, you're not going to injure endothelium. So that's all from my side. I hope you like my stuff. This is a long overdue post. I've been waiting to post this because of some engagements I was not able to. For the past 3 months, I've been waiting to upload this video, but nevertheless, I guess you learned some new stuff from this video. And I would just request you all, students, fellows, and my juniors, my beloved juniors who are supporting my channel, I thank you all. Kindly like, share, and subscribe my stuff. And that's all. The final irrigation aspiration is going on, and you can see the beautiful shine reflects the beautiful Purkinje images that are being formed on the IOL surface. And let's call it a case. I hope you like my stuff. Thank you so much, and have a great day ahead.